But let's now cross over to Mombasa, where investigations into the corruption scandal in the Ministry of Health are taking a center stage. Parliament's Health Committee is due to inspect the mobile container clinics that are said to have been purchased by Afya House. Our reporter Francis Ontomwa is in Mombasa and now joins us with the latest from there. Francis, good afternoon. I understand the committee members are just about to finish with the investigation. Have they arrived at what they are looking for? All right, we will be going back to Francis Ontomwa. Remember, he is covering the Parliament's Health Committee, which is due to inspect the mobile container clinics that are said to have been purchased by Afya House. This is a corruption scandal that did take the country by storm. Reportedly, 5.3 billion shillings allegedly lost at the Ministry of Health. Investigations have been continuing, and these mobile container clinics were at the center stage of the corruption scandal. They're said to have been have cost a lot more than they were supposed to have initially cost, and of course many said that this would undermine the efforts by First Lady Margaret Kenyatta in the Beyond Zero campaign. And the mobile container clinics are this afternoon being inspected by members of Parliament's Health Committee. Those there are pictures of the mobile containers that are said to have been bought by the Ministry of Health. The Ministry of Health, of course, saying that there is no corruption in the ministry, accusing the internal auditor of leaking the report without members or key members of the ministry having gone through that report. And it is a story that our course reporter Francis Ontomwa will be keeping us up to date with. And of course, these mobile container clinics were for maternal health, and it is an issue that angered Kenyans because many Kenyan women have been dying, children as well. Both maternal and infant mortality rates going quite high because of lack of proper mobile clinics in the county level. And we did have a Health Cabinet Secretary Cleopa Mailu, of course, deny those allegations. PS Nicholas Muraguri as well denying those allegations. Let's now talk to Francis Ontomwa, course reporter, joining us live. Francis, good afternoon. Talk to us about what members of Parliament's Health Committee have found this afternoon.
Well, Akisa, the back and forth that Kenyans have been treated to as regards this Afya House scandal has seen members of the Health Committee, of course, make a visit here at the NYS premises at the Miritini area of Mombasa, where these containers, the consignment of some 100 containers, but I'm told there are only 99 at the moment, were brought here. And of course, they have not, they have been received here, but not yet delivered to the health ministries. That is according to the Health Committee, and that is the matter that brought the committee here. They have made the assessment. They've been going through. They have sampled actually some of those containers, of course, establishing some of them had what was in the list, and there are others that they are saying some of those materials that were supposed to be in the boxes have been kept in a different premises. Of course, saying that they are quite fragile. Those are some of the issues that are emerging here, and of course, the million-dollar question that Kenyans have kept on asking is whether they got value for money out of these containers, this consignment that was brought by the Health Committee. There have been back and forth even with the Health Committee. There seems to be no clear answers, of course, coming from some of the members that we've been speaking to. And right now here, I'm joined by one of the committee members, Mr. Alfred Agoy, who is the Member of Parliament for Sabatia and also a member of the Health Committee, to try and help us understand whether Kenyans are even closer to getting answers out of this particular issue. Welcome to KTN, Mr. Alfred.
Thank you very much.
We just want to understand from your initial assessment, did Kenyans perhaps get value get value of the money out of these consignments?
Thank you. We have come here to, as a result of the exposure we had from the Minister of Health, where 5.3 million shillings was supposedly misapplied or used in the wrong purposes, particularly the money that was meant for maternal health care having been used to buy these mobile clinics. So the Health Committee came here specifically to find out what has happened. We know in the budget we wanted also to support slum health facilities, and we had approved a budget for this program, but we were surprised that the money for maternal health care was being used. So we also took this opportunity to find out actually the money we put in the budget, has it been well used? Were the mobile clinics bought, and if they were bought, was the value money for money there? We have arrived here. We have sampled one clinic, which has been assembled for us. We have checked with the help of medical doctors in the committee. What we have ascertained that most of the items are there, most of the items are not there. The other containers are completely closed. One or two we checked, we found there are a few boxes which we could not ascertain what's in the boxes. So we got concerned, and we are telling the ministry that they should move very fast and accelerate this program so that wananchi can get benefit for the money. But the major problem we are facing now is, why was the money for the maternal health care used when the budget for this program was there? The second thing is, now if the items that we have checked, we are going to do further review and checking to find out was the cost really in line with the value for money for the wananchi who are now waiting to receive these services. And that issue we are confronting is the Ministry of Health seems not to have received these equipments. They seem not to have received these mobile clinics. And we know that there is a clear procedure in the Public Procurement and Disposal Act which spells out how payment has to be done. And the procedure is very clear. You have to supply, deliver, install, commission before payment is done. We really want to know also how it happened that 800 million exchanged hands even before the mobile clinics moved from the hands of the supplier to the hands of the government, as we have been told.
Certainly, Mheshimiwa, some of those procedures looks clearly that they were bended. What will you actually have? Has the committee perhaps determined when Kenyans can get credible answers?
As a committee, we have just received the raw data, and we are going to analyze it further so that we know how much money these items cost, if they were priced or if they were not overpriced. We also want to know if the law was bent and which sections of the law were bent, and then we will issue a statement with the effect on what needs to be done as by the mandate of the Committee of Oversight. Yes.
All right. Thank you so much, Mheshimiwa, for your time. That has been Alfred Goi, the Member of Parliament for Sabatia, and also a member of the Health Committee, of course, trying to give us surgery into what has transpired in the morning, going through the containers that were procured by the state, of course, to go to help the slum areas and many other areas in terms of health. That has been the back and forth, and we want to hand things back to you, studio.